Good evening. My name is Doug. I'm from Tinder, and I do ethnographic research. I do qualitative research. I go into people's homes and businesses. I follow them around. I observe. I ask questions, all trying to understand what makes them tick. How many people here have heard of the Affordable Care Act? Okay, so many of you probably would be just the opposite if you were a room full of uninsured people. My question is, the Affordable Care Act, is it affordable enough? And is it culturally appropriate enough to be embraced by all the people that it's intended to serve? Now, I had the opportunity recently to get to know a few dozen uninsured people in depth in their homes to understand their lives and their attitudes. Do people want care, medical care? Yes, absolutely. They know that they need to, they're going to need that for their family, but insurance, they think it's still way too expensive, and they have found ways to get by without it. Now, the Affordable Care Act, you guys probably all know this, intended to give everyone access to care. There are 4 metal plans. The subsidies are based on household income and its percentage of federal poverty level and your family size. So if you are a single person who makes $24,000 a year, you're going to be paying about $132 a month for your coverage. The subsidy would be $119, almost 50%. A family of 4 would be paying $550 a month if they made around $70,000 a year household income. Still about 50%. Still a lot for many households. Now, what do we know about the uninsured? There are about 14% uninsured people in Oregon, 18 nationally. And there are many different psychographic segments which characterize the uninsured in different ways. The uninsured I met are very strong people. They want to work for what they get. They're not looking for handouts, so they're very proud. And I have a few stories here. Katie avoids paying for care for herself. She directs it all toward her children. That's very common with uninsured people. And Jill has an apple a day strategy. She tries to eat healthily and get supplements for her family to insure them against anything that will happen to them. Yolanda has kind of an informal underground meds network where she saves medications and supplies and shares them with family members and friends, and they share with her to take care of themselves. Bill, he finds out what somebody else is doing. Rodrigo, this tree fell on his house. This is a true story. He was so afraid of his insurance rates going through the roof, he decided to fix it all himself, not reporting it to insurance. Julian, an appendix burst, $30,000 later. He says, I don't need medical care, I've only got one appendix. So people are very resistant to insurance. One thing I've understood from these stories is the uninsured have their unfair share of life's bumps, all kinds of things upsetting daily life. And one of those things is that they often have fluctuating incomes. And lots of things happen in different kinds of jobs, sick days, recession, that keep you from getting a regular paycheck. And when you don't have a regular paycheck, it's really hard to say, yeah, I can afford that monthly premium every month at the same level. So when you ask many uninsured about Obamacare or the ACA, they say, oh, Obamacare, that's the only thing they know about it, other than things they've heard in the media, which are very, not positive at all. So what can we do as healthcare insurers and providers? I'm outlining just a few really broad brushstroke ideas here. You guys could probably add tons to these slides, and I hope you will afterward. Affordability is much more than just subsidies. Affordability is about creating a kind of an ecosystem where people are able to achieve a more stable existence. Things like how to budget basics, simple things, building links between jobs and people, a la carte care, things that allow them to get care kind of on their terms. And if WebMed and Google are go-to resources for many people when they're thinking about their own healthcare, what else can we do that will help them do things they're already inclined to do? Advice lines on steroids, another use of steroids here, not literally. And finally, re-engaging people in with something that they're very distant from. Many uninsured have never had health insurance or haven't had it for a long time, so they're not familiar with how it works, and they have a lot of distrust around that. You may have seen Cover Oregon's great campaign, Live Long Oregonians. It's very fun, very grassroots, and hopefully it will attract those 90% of Oregonians who know almost nothing about the Affordable Care Act. So the wheels are in motion. In less than 2 weeks, the exchanges are going to be online. And I look forward, I guess with all of you, to see what we can do to make health care accessible to everyone, a reality for all people in Oregon and the country. Thank you.